Physical therapy treatment of ankle sprain. Home recovery. Physicians generally recommend that you avoid sports and everyday physical activities until your sprained ankle has healed. Crutches are usually prescribed for the 1 to 3 weeks after a moderate or severe sprain. Household tasks that require you to be on your feet may be difficult for a few weeks after a moderate to severe ankle sprain. It can be helpful to arrange for someone to visit you to help with any physical chores. In general, you should continue R.I.C.E. treatment as instructed by your doctor until symptoms go away. After 72 hours, your physician may prescribe heat therapy. Only apply heat if the sprain has healed, which may take up to 3 months. Heat draws blood to the skin around the ankle, which may increase swelling and internal bleeding if used too soon after a sprain. Many heating treatments are available and physicians generally suggest a specific heat therapy at their discretion. Heating options include heat lamps, hot showers, heating pads, heat ointments, and whirlpool or bath treatments. Massage also may be used to soothe muscle pain. However, massaging an injured ankle can disrupt the healing process and damage injured ligaments right after an injury. Your physician will decide when it is safe to begin ankle massage. Proper nutrition may also help heal an ankle sprain. Your physician may suggest taking vitamin supplements that contain vitamin C, vitamin A, vitamin E, and selenium. However, research has not yet proven how important nutrition is for healing nor which vitamins, minerals, or supplements are the most effective. Your physician will either suggest physical therapy that can be done at home or refer you to a physical therapist within a week after the sprain to help you restore range of motion in your ankle. Rehabilitation. Physical therapy usually is prescribed to help ligaments heal after most moderate and severe ankle sprains, as soon as possible after the sprain. Your physician may refer you to a physical therapist to begin early motion, which helps circulate fluid out of the ankle. Early motion consists of simple up and down flexion and extension, and progresses to small circles or drawing the alphabet on the floor with your toes. Therapists also may use electrical stimulation to control swelling. Knowing when to start more vigorous rehabilitation exercises is difficult and should be decided by your physician. Physicians generally recommend that you avoid bearing weight and walking in pain after an ankle sprain. Patients tend to heal better in the long term if they start rehab slowly, instead of rushing to begin painful exercises on an ankle that has not yet healed. When swelling and pain have gone away and you feel comfortable without supportive wrapping, you usually start an exercise program to strengthen all the muscles around your ankle. Elastic bands are often used to provide resistance as you move your ankle in different directions. The amount of resistance increases over time as you regain strength in the muscles around the ankle. You may help your ankle feel better by icing it for 10 minutes both before and after rehab exercises. It is particularly important to strengthen the peroneal muscles located on the outside of your lower leg around your small lower leg bone, fibula. The peroneals help keep your ankle from turning inward. Arthritis may result from repeated ankle sprains, which can hinder your ability to return to your previous activity level. People with arthritis or who suffer repeated ankle sprains may need to spend extra time in rehab and perform a more elaborate training program. The final steps of rehab help increase coordination and may include balance beam exercises and running in a figure-8 pattern. When the injured ankle is about 90 to 100% as strong as the uninjured ankle, you may be ready to begin returning to activities. Most patients can rehabilitate their ankles with less than 3 months of physical therapy and return to activities at full strength. Prevention. To prevent the recurrence of ankle sprains, you should make the stretching and strengthening you learned in physical therapy part of your regular exercise routine. A strong and flexible ankle may be better able to withstand any abnormal positions and strain that occur during sports and recreational activities. Before activities, remember to warm up your ankle muscles by stretching in all directions. Tight ankle muscles and ligaments may be more apt to pull or tear. Replace athletic shoes when the padding or the tread wears out. Avoid participating in activities in old, worn-out shoes because they do not provide good padding or side-to-side support. Taping and bracing. In general, you should try to provide extra support to your ankle for at least 12 months after a severe sprain, possibly longer. Taping is a good preventive measure if it is done immediately before participating in the sport, and if the person doing the taping is trained in proper techniques. Ankles are usually taped all the way from the midfoot to the lower calf. Physicians generally do not advocate the use of braces for people who have not had ankle injuries, but for people who have had recurrent injuries and those in the early post-injury period, braces may be useful to enhance recovery and prevent further injury. Neoprene sleeves simply provide compression, and other lace-up types of braces provide more support using metal or plastic strips on the sides of your ankle. Dealing with pain. A small amount of pain is normal during activities. But if you feel so much pain in your ankle to warrant taking a painkiller before an activity, you should consider cutting back or stopping. If you experience significant pain in your foot or ankle, do not continue to run on a sore ankle. Pain after rehabilitation could be a sign that you have excess scar tissue, loose fragments of bone or cartilage that were not seen on the initial X-rays, or other minor foot and ankle injuries that need proper treatment before you can return to activities. Treatment introduction. Non-surgical treatment can usually heal ankle sprains. Physicians typically prescribe a combination of R.I.C.E, rest, ice, compression, and elevation, medication, and physical therapy. Immediately after you suffer an ankle sprain, you may want to follow the first aid routine known as R.I.C.E. rest. Your doctor will likely suggest that you refrain from sports activities and lie or sit down for a few hours at a time every day until your ankle sprain heals. Just the weight of your body puts pressure on the ankle, lengthening recovery time. Ice. Initially, your doctor will likely recommend applying ice packs to the ankle for about 20 minutes every 3 or 4 hours. You will probably need to do this for 2 or 3 days or until the pain subsides, and you may do it after exercise or activities. One effective way to apply ice is to use a bag of frozen vegetables, which molds easily to the shape of the injured area. It won't leak and it can be reused. Warning: do not eat the contents after thawing and refreezing. Compression. Doctors often recommend bracing or wrapping your ankle. There are many different types of bandages, braces, and splints that your doctor may choose to prescribe. A wrap is often effective, but a removable air cast is usually the most secure way to stabilize your ankle. Elevation. Raising the ankle to a level higher than the heart helps reduce swelling. Try to prop your ankle up on a couple of pillows when lying down or sleeping. You may be prescribed pain medication as needed, depending on the severity of your ankle sprain. For minor sprains, most patients receive adequate pain relief from non-prescription painkillers, like aspirin or ibuprofen. More severe sprains may require narcotic painkillers or, in rare cases, an injection of painkiller directly into the ankle. Your physician will decide when it is appropriate to visit a physical therapist to begin stretching and strengthening exercises for the ankle. Most patients begin physical therapy within a week of an ankle sprain. The time it takes to heal ankle sprains is highly variable. Mild sprains typically heal in 2 to 10 days. Moderate sprains may need 10 days to 6 weeks to heal. Severe sprains can take between 6 weeks and 4 months to heal. Your physician will probably prescribe a few regular checkup visits if you have a moderate or severe sprain, but most of the treatment can be done at home. Syndesmotic injuries, high ankle sprains. A high ankle sprain is a partial or complete tear of the ligaments above the ankle joint. A ligament is a strong fibrous band which connects bone to bone. Ligaments provide stability to joints and unlike tendons, they do not stretch. A sprain is an injury to a ligament, which could be a stretch, partial or full tear of the fibrous tissue band. The ligaments above the ankle joint are called the syndesmotic ligaments and commonly referred to as the syndesmosis. There are 3 main ligaments which connect the tibia, also known as the shin bone, to the fibula, the thin bone which sits adjacent to the tibia at the outside of the leg. A connective tissue sheet, called the interosseous ligament, connects the fibula to the tibia and extends from the knee to the ankle. A syndesmotic injury is caused when the foot rotates outward and is forced upward. This type of motion can occur in sports such as hockey, football, soccer and skiing. Syndesmotic injuries can occur in isolation or with an ankle fracture. When they occur in isolation, they may present with very little swelling or bruising, which makes diagnosis difficult. Mild syndesmotic injuries may have some swelling and bruising on the outside of the ankle, and more severe injuries are associated with ankle instability. Diagnosis is made by physical exam and radiographic evaluation. Squeezing the calf and externally rotating the leg will elicit pain, and the front of the ankle is very tender to direct palpation. An X-ray will rule out fractures and other conditions, but will also help evaluate the severity of the injury. A stress X-ray is taken with the foot angled outward, and a gap between the tibia and the fibula is indicative of a more severe syndesmotic injury. An MRI or a CT scan may aid in diagnosis, but are typically more beneficial when evaluating more severe syndesmotic injuries. When only one ligament of the group of syndesmotic ligaments is stretched or partially torn, the injury is considered mild and the ankle is usually stable. Treatment is similar to treatments for common ankle sprains and involve anti-inflammatory medications, ice, compression and immobilization. Early weight bearing is generally recommended for ankle sprains, but if a syndesmotic injury is suspected, crutches will be needed before progressing to rehabilitation. Recovery time will be between 1 to 2 months. If 2 or 3 of the ligaments are torn, the ankle becomes unstable. If stress X-rays reveal gapping between the tibia and fibula, surgery involving placement of a screw across the leg bones may be necessary. A key component of ankle instability is the integrity of the deltoid ligaments. The deltoid ligaments extend from the inside of the ankle at the base of the tibia, medial, malleolus, to the bones in the foot. When the deltoid ligaments are torn, ankle stability is severely compromised. Studies have shown that the most important determining factor indicating the need for surgery in syndesmotic injuries is injury to the deltoid ligaments. When the ankle is unstable and surgery is required, recovery time can take to 6 months. The first few weeks require non-weight-bearing and ankle immobilization, but after 2 to 4 weeks, active mobilization and physical therapy can be initiated. The amount of activity can increase after 6 to 8 weeks, with full impact activity beginning at around 3 months.